of people are worried about money, the money in the medical system, and how money could bias or push medicine to get people to take something that they don't necessarily need to take. That's a frequent criticism of the seasonal flu vaccine.
Right.
Is that it's for profit. It's not really. Most people are going to get a different strain of the flu anyway, regardless of whether they take that vaccine. So it's like, well, how much of this could be greed motivated for the medical community?
It's difficult to say. Greed is a human quality or human sin that is present at every level of society. It's not exclusive to the Western medical community. It's,
Right.
to me, it's just as represented in the alternative care community. People do things for money and pursue their own agenda for money. As when it comes to any kind of medication or pharmacological intervention, it needs to be judged on a person-to-person basis. Personally, I've never taken the flu vaccine because I never considered myself as a at-risk patient, and I don't feel that I need to take vaccines to prevent potential exposure to certain diseases. I think that there is an overuse of vaccines. I think that there is an overuse of drugs in general. And I think that is a real shame.
Those are the sort of the cracks in the walls.
These are the cracks in the walls. And again, it's very cultural, it's very different between cultures and different places and different countries. Again, I've been running clinical trials globally for the last 20 years. And you can recognize patients from different countries on the basis of the medications that they take and how many medications they take. So certainly in certain countries, people have a more interventional type of medicine, and also a more reparative type of medicine. So people get sick and then they get healed, right? Or they treated. In other cultures, you have preventative medicine. So a lot of people don't get sick because their doctor would kind of institute protocols before they get sick so that they don't get there in the first place. Again, the big misconception is that the pharmaceutical industry only cares about making money at expenses of people's health. And that to me is so bizarre as a concept. Again, that's been like my professional environment for the last 20 years. Academia, actually for the last 30 years I was in academia, first, and then in the pharmaceutical industry. There isn't a lot of difference between the two. Yeah, I mean, everywhere, some people are more motivated by money, and some people are more motivated by science. Some people are motivated by the desire to help others. And I met all kinds everywhere, in academia, in general practice, and in the pharmaceutical industry.